Amlodipine 5 mg, normal uses and side effects. What is the difference between 5 mg and 10 mg? Amlodipine is a widely used drug that belongs to the class of calcium channel blockers and is primarily used to treat high blood pressure and chest pain. Available in a variety of strengths, the most common doses are 5 mg and 10 mg, each with different uses depending on the severity of the condition, the patient's response, and clinical requirements. Dosage and potency. Amlodipine works by relaxing blood vessels, thereby lowering blood pressure and improving blood flow to the heart. The magnitude of this effect is directly influenced by dose intensity. The 5 mg dosage strength is lower and is often used as a starting dose for people with mild to moderate hypertension or angina. It can lower blood pressure modestly, and is usually enough for people who don't have serious medical conditions or are more sensitive to the effects of medications. This dose is also commonly used in elderly patients or those with impaired liver function because the liver metabolizes amlodipine and decreased liver function can lead to higher levels of the drug in the blood. In contrast, the 10 mg dose is a higher strength and is intended for patients who need more robust blood pressure control or enhanced relief of angina symptoms. This medication is often prescribed when a 5 mg dose is not enough to reach target blood pressure levels or control chest pain. The 10 mg dose is the maximum recommended daily dose for most adults and provides a stronger therapeutic effect due to increased drug concentrations in the body. This higher potency makes it suitable for people with more severe hypertension or coronary artery disease who need a significant improvement in blood flow to the heart. Use. Amlodipine 5 mg and 10 mg are primarily used to treat hypertension and angina, but their use varies depending on the patient's clinical condition. High blood pressure, or persistent high blood pressure, is a major risk factor for stroke, heart attack, heart failure, and kidney disease. By relaxing blood vessels, amlodipine reduces pressure on artery walls, thereby lowering these risks. For people with mild to moderate hypertension, a 5 mg dose is usually sufficient, especially for newly diagnosed patients or those whose blood pressure readings are only slightly above normal. It gently but effectively lowers blood pressure, helping patients reach their target levels without causing an excessive drop in blood pressure that could lead to dizziness or fainting. On the other hand, the 10 mg dose is often used in patients with more severe hypertension or those whose blood pressure is not adequately controlled with the 5 mg dose. Severe hypertension is characterized by significantly elevated readings and requires a more aggressive approach to prevent organ damage. The 10 mg dose has a stronger vasodilatory effect and can lower blood pressure more significantly and rapidly. This makes it a key option for patients at high risk for cardiovascular events or those with resistant hypertension, for whom other drugs alone are insufficient. For angina, chest pain due to reduced blood flow to the heart muscle, amlodipine improves blood flow in the coronary arteries by dilating the blood vessels. For patients with stable angina who experience predictable chest pain during physical exertion or stress, a 5 mg dose is often effective. By increasing blood supply to the heart, this dose can reduce the frequency and severity of angina attacks, thereby improving quality of life. The 10 mg dose is for people who have more frequent or more severe angina attacks, including those with variant angina, caused by coronary artery spasm, or those who do not get adequate relief from the 5 mg dose. Higher doses ensure greater dilation of the coronary arteries, providing greater ischemic protection. Onset and duration of action are similar for both doses, with the effects of amlodipine generally becoming apparent within a few hours of the first dose and reaching their peak after 6 to 12 hours. Because amlodipine has a long half-life, 30 to 50 hours, it only needs to be taken once daily for 7 to 10 days to achieve steady-state blood pressure control. Patients taking 10 mg may notice more significant effects sooner due to the higher drug concentration, but continued use is necessary to fully realize the benefits of either dose. Side effect. Amlodipine is generally well tolerated, but the likelihood and severity of side effects increase with increasing doses. The 5 mg dose has a lower incidence of adverse effects and is therefore the preferred starting point for most patients. Common side effects at this dose include peripheral edema, swelling of the ankles, feet, or legs, dizziness, facial flushing, fatigue, headache, and nausea. These side effects are usually mild and gradually decrease as your body adjusts to the medication, usually within a few weeks. The 10 mg dose carries a higher risk of side effects due to increased drug concentrations.